Jennifer Kaltmakarov here to talk to you today about egg donation. This is a topic that's not talked about a whole lot. So unlike fertility, which is more out in the open, people are comfortable talking about it, egg donation still not talked about a lot. We don't hear a lot about it on social media. So I want to talk about egg donation today. So what is egg donation? This is a fertility therapy for women, same-sex couples, men who are trying to start a family. So in this treatment, an egg donor will come and donate her eggs. So her uterus, her fallopian tubes, but the eggs, here, she goes through an IVF cycle to stimulate the growth of her follicles. Egg donors are usually young, under the age of 32, so they produce a lot of egg follicles. The egg follicles are then either frozen, and then transferred to the recipient's uterus, or they can be transferred directly into the uterus without freezing. But these are the two options. More common these days are egg banks where the eggs are frozen, and from one cycle from a recipient, those eggs can be split between many couples or men and women trying to start their own family. So who might need an egg donor? So women, a lot of times with age-related fertility, women over age 40 may have low numbers of eggs or their quality. They've tried IVF and they're just not getting good quality eggs. They might be candidates for an egg donor. Some women who are younger go through premature ovarian failure, and they may also be a candidate to have an egg donor. Some same-sex male couples may choose to use an egg donor and a gestational surrogate to start a family. And also a couple who one of either the male or the woman is a carrier of a rare genetic condition. Another common thing that I see in my practice is lesbian couples where one wife will donate her egg to her partner to carry the pregnancy. So that's a type of egg donation as well. And then let me talk more about the egg donors. Who are egg donors and what do you know about them? So egg donors are, again, they're usually 21 to 32 years of age. They're screened to make sure they do have a good follicle count, and so they're good candidates to be an egg donor. They're also screened. They get infectious disease screening, genetic screening. A full history is taken to make sure, to check that they don't have any significant medical conditions, and their family history is also screened. And so when you're a recipient, what we call a recipient, looking to be a recipient of an egg donor, you get to see all this information. You don't get identifying information for anonymous egg donors, but you get to see even their picture, sometimes their writing, so you get to know personal features like hair and eye color, ethnicity. So you do get some choices there. You get to there's other couples, again, who do known donors, like the lesbian couples, or someone may choose to have a sister donate eggs and she can carry the pregnancy. So these are other types of egg donations that we do. And this, so for, again, this is for the recipient if their ovaries are not working anymore, but it's very separate. Some people are confused about that. It's very separate than the uterus, because the uterus, it doesn't age the same way. So that's how some of the older pregnancies you hear about, women who are closer to 50 giving birth, some of those are with egg donation, because the uterus itself doesn't age in the same way as the ovaries. And to prepare the uterus to be a recipient of an egg, through egg donation, we give some estrogen usually that builds up the lining here. And the uterus usually can get receptive for an egg donation even when women are older. Okay, and this is a very successful treatment. A lot of fertility treatment depends on the quality of the eggs. Not everything. I mean, you have to do some screening to make sure your uterus is okay, but if your screening is clear, a lot of the success of fertility treatment really depends on the quality of the eggs. And we try to ensure as much as we can that the egg donors have good quality eggs. So egg donation treatment is often very successful with pregnancy rates and live babies born. And I myself have had a lot of patients go through this treatment and be very happy with egg donation. So that's what is egg donation. Thanks for watching.